Governor, my off-topic on the coronavirus task force report, you pushed back on the reporting of the White House's coronavirus task force report as fake news, as an attack from the liberal left and the media. Do you dispute the findings of the coronavirus task force, and what is not being covered is my question.
Yeah, I'm glad you asked me that, because I certainly did push back on the biased, one-sided reporting by the Atlanta Journal-Constitution on a leaked report. You know, we're publishing numbers every single day on the Georgia Department of Public Health's website that Dr. Toomey and her team are doing. What the article that the AJC wrote didn't tell Georgians that right now our hospitalizations are down 18.8% since our peak on July 30th. That's the lowest level since July 13th. Our 7-day average of new cases reported are down 26%. 26% since our peak on July 24th, and they're the lowest since July 8th. Our 7-day average of tests coming back positive, or our percent positive, which is something that everybody's been focused on. 2 weeks ago, they said it was way too high and we had to do something. Well, we've been doing something. That is down from 14% on our peak on July 17th to 9.7% as of yesterday. It's good to be below 10%, which we are. It's better if we can drive it down to 5%, which is what we continue to try to do. Our transmission rate of the virus, according to the AJC's own website, even though they didn't include this in the article, is less than 1, which is good. If you're more than 1, it means the virus is spreading. If you're less than 1, it means that you're doing a better job of containing it. We're at 0.85. You know, this is what's so frustrating about pandemic politics and leaked reports. We're glad to talk about these numbers every day. Dr. Toomey did press all week. I don't think I've seen hardly any of that quoted in the paper. So I wouldn't be able to speak to who leaked the report, why they leaked it, what the politics were behind the leak. All I'm asking for is Georgians to get all the information. If we're the highest percent capita in the state right now, that's because Texas and Florida and Arizona and some of the other states that were peaking a week or two ago are on the downcline, just like we are. But that is not the only number that Georgians need to look at. And I will tell you that the media only focuses on the bad numbers. They never focus on the good numbers. You look back 3 weeks ago, the focus was on hospitalizations. We're going to run out of hospital beds. Well, you know what? We had a plan for that. We had a surge capacity plan, which we stood up. We have not run out of hospital beds, and we have allowed every single hospital, for the most part in this state, on normal days to be able to do other procedures other than dealing with COVID patients, to help all Georgians get access to health care for critical services, not just COVID, but also to help their financial bottom line. So all I'm asking people is to follow the data that's on the Georgia Department of Public Health's website. Dr. Toomey is talking to her people that are on the ground every single day. We're looking at the contact tracing data to understand where the spread's coming from. And we've also said, when we open schools, when we open back up, we're going to have things that happen. The reason that we shut down for a few weeks in the first place was to build the hospital capacity, was to build up the PPE supplies, the ventilator supplies, and all the other things that we needed to do so that we were able to deal with this situation when it got here. And I can promise you, we will continue to do that. We'll continue to fight to protect lives in our state. But we also have to focus on livelihoods. Unemployment, you know, has run out. We're working with the President's executive order as fast as we can with Commissioner Butler's office to fix that. But I talked to a guy this morning that literally told me he had a salon. A friend of his was telling me that this guy had a salon business that was literally on the verge of selling everything and shutting down when we opened up. And we know if we shut down again, there will be businesses and jobs that will be lost forever. We have to think about that as well in our fight, and that's what we're going to continue to do.
Governor Kemp, Sam Whitehead from WABE, thanks for taking this question. All those statistics can be true, and Georgia can still have the highest case rate in the country. it's easy to point at the AJC, but this is a report coming from the White House, and they've made recommendations for multiple weeks
No, this
now.
is a report that was leaked to the AJC, and they didn't write about all the numbers. You're not
Sure.
being truthful with people.
Sir, but this
So
report has
just look, I'm fine. If you want to put the per capita numbers out there, I look at them every day, and that's good. But when you put that out there, also put that those numbers have dropped 26%. Also put that our hospitalizations have dropped. To scare people with one number is not fair to the general public. You are not giving them the benefit of the doubt to make good decisions based on all the data. That's all I'm saying. I'm not afraid. I can't tell you how many press conferences that I've done and taken every single question the whole time. And all I'm asking is for people to put all the data out there, or to just ask for our side of the story in the article.
And sure, and to finish the question, how many times does the White House need to make a recommendation that the state do something like bars before that is a measure you take? This is a recommendation that's been made for multiple weeks
The
now.
coronavirus task force, as you know, the president and the vice president say it every week. They're supporting the governors to make the decisions in their state. And I have great appreciation for President Trump saying that and for the vice president saying that. I have met with Dr. Birx, but you know, Dr. Birx is not our public health director in the state of Georgia. Dr. Toomey is. And if Georgians will take the time to look at her resume, to look at her qualifications, she has worked with Debbie Birx in the past. She has worked with Dr. Redfield in the past. I'm pretty sure she's worked with Dr. Fauci. If she hasn't, she knows him very well. We've worked with Dr. Adams. So we take their recommendations, but it doesn't mean that every governor is going to follow every single one of them. Because like I told her, the contact tracing we're seeing has nothing to do with in-person dining. It has everything to do with social gatherings that are happening outside of businesses and other things, and that's why we continue to focus and ask people to do 4 things for 4 weeks. Socially distance, wear your mask, wash your hands, and follow, but yes, let's enforce the current regulations that we have. We have a gatherings ban. Do we have anybody enforcing that at the local level? That would be a good question for the press to ask. We are doing all we can with our law enforcement to protect lives and property all across this state right now. And we can't be every city's police agency. I would urge them to enforce the regulations, especially on the gatherings ban, on social distancing, and whatever else that's in our orders or orders that they are now doing.
Governor Kemp, Brandy Andy from CBS 46. Putting that report aside and moving over to Harvard's Global Health Institute, their COVID-19 tracking information, they're listing Georgia as the #1 in the country for transmissions rate. So my question for you is, does this bother you that we're at the top of the list, and have you even thought about maybe reaching out to other states?
Well, like when is that data from? Is that from Sunday, yesterday?
It's the most
2
recent,
days ago?
It's the most recent
Because it
information.
depends, because like if you looked at the Wall Street Journal where you're having the per capita per 100,000 cases, you know, 3 days ago, we were on the top of the list. Today, we're not. Yesterday, we weren't. So what day are you talking about? And it also depends on, you know, one of the things that's making our per capita cases go up is our demand for testing is going down. You know why? Because there's not as much spread going on. People are not as anxious as they were 3 or 4 weeks ago because things got very hot. Everybody knew they had to do better, and it's been working. You know, we've been encouraging people to do that. A lot of other people have as well, and we're on the backside of the spread. But you can't blame the government because people don't want to go get tested now. I want to continue to urge all Georgians to get tested. In a lot of ways, it would help me out if people where there's not much spread would go get tested because it skew the numbers the other way. But from a public health perspective, and what Dr. Toomey has us focused on is we're focusing on the areas where we see the highest spread. We're contact tracing where we have outbreaks. And when you do that, your percent positive is going to be higher than if you just test everybody everywhere. But we're doing that because we're focused on protecting the most vulnerable. We're focusing on our long-term care facilities, on our places where we've had outbreak. So, that's why it's important for people to look at all the numbers in regards to that.
So what about the transmission rates at an education level? If you look over in Cherokee County in the past 2 weeks with face-to-face instruction returning, we've already seen 3 separate high schools have to close because of how quickly things spread. And so we do have a lot of anxious parents. We do have a lot of anxious parents there. So what do you say to those parents who are worried about their children right now as those cases continue to spread?
So
At an education with face-to-face instruction, what do you think needs to happen? Should masks be mandatory within schools? Like, what steps are you currently considering in order to, make a difference within those school districts that have face-to-face instruction?
Which one of the questions did you want me to answer first?
What are you doing about schools?
Well, what was the first question you asked me? I know you don't remember, so I'll repeat it for you. You asked me if it was concerning about the kids coming back to Cherokee County and them having to shut schools down because of the spread. Well, the spread didn't happen in the school for the most part. It happened because people came back to school and they already had the coronavirus. So is that the government's fault? Is that the school's fault? No, it is not. But what we're doing is exactly what is on CDC's website and what Dr. Toomey has recommended and what the superintendent up there thinks is the best thing to do. They did the contact tracing, they're doing the quarantine, and where they felt necessary, they shut the schools down. But for you to put panic out there for every other district that's in the state that is open very well and hadn't had any issues, I think quite honestly is unfair. I mean, they're dealing with the Cherokee situation. Do I wish it wasn't happening like that? I certainly do, but also know that I've talked to multiple other superintendents and teachers that has been open, some of them up for 2 weeks now, and have had no issues whatsoever.
How have I personally created panic? Let me answer that question for you. I haven't. You can't point to a single story that I have. Everything I have done is balanced and just reporting what the school districts and the state are doing. Thank you.